Hi, class. This is Gary. We're getting ready to start week 2. We're going to dive into chapter 1 real quick in your book. Again, if you are having issues with your book, please make sure that you personally reach out to me so that I'm able to assist you in any way with chapter 1. I'm more than willing to scan and email you chapter 1 as we go through. I understand ordering books and things like that take time. So, please make sure that you reach out to me personally if you do have an issue with the book. So this week, the chapter of our chapter 1 is Introduction to Wellness, Fitness, and Lifestyle Management. When I do these videos, I'm going to give you some highlights from the chapter, things I'd like you to focus on as we work through the chapter. Please keep in mind in week 4, you will be taking a quiz based on the information from chapters 1 and chapter 2. So you will need to read all the information associated with those 2 chapters to make yourself familiar with it as we do work through that information. So a couple things I want you to focus on in chapter 1. I'm going to go through page by page with you so you can kind of follow along as I'm doing this. On page 2, the biggest things are understanding the difference between health and wellness. Yes, there is a difference between health and wellness. Health is the overall condition of body and mind in the presence of absence or illness or injury. And, however, wellness is the optimal health and vitality encompassing all dimensions of well-being. Now, the dimensions of well-being are the next thing that I'd like you to focus on, and you can find those on page 2. They are physical, emotional, intellectual, interpersonal, cultural, spiritual, environmental, financial, and occupational. The thing to remember about dimensions of wellness is if one of those dimensions of wellness is not being met satisfactorily, it will affect everything. Imagine how if you are unhappy with your work, or if you would lose, heaven forbid, lose your job, that would affect a lot of your other types of wellness, including financial, potentially your interpersonal, your emotional, maybe your physical from the stress of not having, how am I going to pay the mortgage when it comes due the first month? How am I going to pay the rent? How am I going to put gas in my car? Things like that. I mean, that all takes a toll on us emotionally. The top of page 3 gives a lot of valuable information in terms of the dimensions of wellness as well. As you continue to work through the chapter, lifestyle choices is something that's important to remember as we go through. Lifestyle choices are defined as a conscious behavior that can increase or decrease a person's risk of illness or disease, such as behaviors including smoking, exercise, and healthy eating. Now, most people associate lifestyle choices with negatives: smoking, drinking alcohol, drug abuse, things like that. However, as we work through this, you will notice as we work through, lifestyle choices can be good things. Choosing to exercise, how to eat healthy. Maybe you are not a fan of red meat, so you have the lifestyle choice of being a vegetarian or maybe a vegan, something like that. Maybe you have lifestyle choices of from religious points of view. So there's a lot of things to keep in mind as we work through this. One thing is how lifestyle choices affect diseases of the body, both positive and negatively. Our body has 2 types of our body can have illnesses in 2 ways. One is an acute illness, which is an illness that usually lasts less than 2 weeks. Those acute illnesses are maybe the common cold, maybe a stomach virus, the flu, things like that. Those would be considered acute viruses or acute conditions. Other conditions are more are chronic, high blood pressure, asthma. Things that stay with us for longer than 2 weeks. I didn't pick the 2-week timeline, but in medicine they define acute and chronic based on that 2-week period. So it's important to remember that those chronic diseases not only can affect us emotionally, physically, but potentially financially. Imagine putting yourself in a position where you have a chronic disease, but you don't have health insurance. Or something like that. So that's something to keep in mind as well as you're moving through. Please pay particular attention to table 1.2 on the top of page 7. key contributing factors to American deaths. That's important to remember, just to look at, just kind of giving you something to a relationship to disease. Page 8, physical fitness. We've discussed the definition of health. We've discussed the definition of wellness. Now we're going to discuss the definition of physical fitness, a set of physical attributes that allows the body to respond or adapt to the demands and stress of physical effort. Okay, so that's one thing. When we put our bodies are really unique. They will respond to the stresses put on them physically. Okay, so if any of you have ever lifted weights, okay, let's say you lifted weights for 5 or 6 years, what you've started at, maybe your bench press was, I don't know, you did 125 pounds. Let's just say, use numbers. Okay, more than likely, you're able to, if you've consistently done weightlifting, you can do 125 pounds many reps of those 125 pounds, or you're able to lift more than that. And that's our body adapting to that physical stress, that positive physical stress as far as exercise goes. So that's something to remember as well, especially as we're moving forward, as we get into the muscular strength and muscular endurance section. A couple things, please pay particular attention to the figure 1.5 on page 10. It helps us the benefits of a healthy diet, the benefits of exercise. Obviously, that's something that we need to be very concerned about as we're moving forward. Okay, maintain a healthy body weight, manage stress effectively, avoid tobacco and drug use, and limit alcohol consumption. Protect yourself from disease and injury, and take other steps towards wellness is something also that we need to, are some topics that we need to focus on as we move forward. Okay. Obviously, one of the biggest things that we're going to have an issue with, especially for those of you that have either not exercised in the past or have not had or try to get back in exercise, is a behavioral change. I included in the fun facts a little tidbit of information regarding the 21-day, taking 21 days for something to become habit. Hopefully, you're all remembering to wear your Fitbits. There are a couple of you. Since we're on that topic quickly, let's make sure that we're all registered for that, for our little community there on Fitbit.com, so that we can track our we can track our wellness throughout the semester. Okay. The biggest thing is creating a goal. Getting out of chapter 1, creating a goal and writing it down. That's something that's really important, and I think it's a step that a lot of people miss as they're going forward in their goal making. They just make a verbal goal, and they don't really say anything to anybody about it. The best way to make you accountable is A, write it down, and tell someone. The best way to be able to function with your goals is to find a partner. Find someone that has a common interest of you. And that's also another important thing as we're beginning exercise. If you like to go to the gym and be around those people and get on the treadmills and the bikes and ellipticals and stuff, don't make yourself go out and run. If you don't like running, don't do it. Go swimming. Go do something. Do something that you enjoy, because if you do something that you enjoy, it will help you in the long run with your willingness to stick with it. And that's the biggest thing. So as we're setting our goals, a couple things to keep in mind. A, write them down. B, tell someone about them. And the best option is not only to write them down and tell someone, but find a partner that can work with you on those. So that's something that we can use to get into our, help us be able to move forward. Okay. I'm going to start tomorrow. Tomorrow never comes, folks. So, make the decision to start today, and we'll go on this journey together for the next 15 weeks. And hopefully that you guys will find something out of this course that will make your lifestyles better, that will make you a healthier person, and something that will be of greater benefit to you. So this is something I plan on doing every week, as far as a weekly a weekly update. I hope to have it done before the first day of the week, but here we are. So have a great week, guys. I'm really looking forward to the discussion post this week. Keep in mind to really dive in when you're looking to respond to your classmates. Be positive, but one of the nice things about the forum that we're in is not everyone's going to agree. So it's something that we will be able to use as we're moving forward, and be able to create that dialogue. Maybe one person will say something that makes it stick for someone else, and that's the real benefit of being in this setting. So again, if you have any questions, please feel free to email me or reach out to me in some way, shape, or form. I'm really looking forward to this week. I'm excited to get started, and hopefully you are too. All right, guys, have a great week. I'll talk to you soon. Take care.